Hi everyone and welcome to my channel. This video is going to be about our fertility specialist appointment that we had where we are looking into private IVF and hoping to be referred for a lipidol treatment. I have already filmed one video that was before our appointment, just talking about that and things pre-appointment, so I will hopefully insert a link somewhere along here if I can work out how to do that. So our appointment came around really quickly. We actually ended up being like 40 minutes early, I think it was. We were just so nervous and thought, oh well, we've got to find a car park. So we sat in the car for like 40 minutes. I do have footage of that. If I can, I will insert that here. So we have just parked. We are going for our first IVF appointment. Haven't been back to Fertility Associates in a couple of years, I think. Finally looking at doing a private round of IVF and hopefully a referral for a lipidol treatment. I'm really nervous, don't know why. I suppose it's a pretty big thing. How are you feeling?
Nervous.
Here's a man of few words. So we'll be going in soon. We're of course like 40 minutes early. But yeah, we'll update you after. So we went up to our appointment. They were running about 20 to 30 minutes late. So my nerves were really, my stomach was just butterflies really. But we finally went in and saw our specialist. We talked everything over and she asked what would we like to do, talked about how IVF. I showed her my notebook with all our supplements, my cycles, vitamins, medications, stuff like that. So I got it out and I had my questions there, but I didn't really have an opportunity where she said, do you have any questions? So I just kind of slid some of them in there. More about like how many eggs she would probably like to see for someone who has PCOS in our situation. She did say about 4 to 20 follicles would be good. Should hope to see that. And sorry, this video is probably going to be really jumbled just as I remember everything comes back to me. But she said that they only do 5-day transfers. 5-day embryo transfers. I'm sorry, I'm not sure about the terminology. Unless we have under 4, then they would consider a 3-day transfer. So that was really interesting because I didn't know about that. I talked to her about the lipidol flushing treatment that I would really like. So the poppy seed oil that goes through your tubes and everything. She was really not on board with that. She said that there's just not that much evidence. The study was done a long time ago, not with a big group of people. So I was like, oh, okay, well, if you don't really think that, then at least we'll save some money, because I think it worked out to be about $980 the lipidol treatment would be. So I was like, oh, okay, that's fine. So she did, her an internal scan. My left ovary is still polycystic, but at the moment my right ovary was not. So that was good, but she was worried about a polyp, having a polyp. So she said, I will actually refer you for a saline infusion. I do have the leaflet here. So I'm not sure if you can read that. There's different information on it. So saline infusion sonohistography. I'm terrible with pronunciation. And SIS. So this is basically you'd have this, then they'd put through the Lipitor through your tubes. So it's like, okay, well, if you're referring me for this, is it okay if I see about the Lipitor? So she said, yeah, well, you may as well see what they suggest. But if you do have the Lipitor treatment, a few days after, about up to a week, you have to have your thyroid tested, because what she's worried about is it would cause my thyroid function to go weird. I've never had thyroid issues, but she said that if that did happen, we would have to keep testing the thyroid, and we wouldn't be able to do IVF until after that. So I'm still going to talk to the reflect radiologists where you have it done. I'm still going to talk to them about that and see what they suggest. You know, we just want to up our chances any way we can. So the saline infusion, she did say to me, is she's been told by her patients is one of the most, pretty much the most painful procedure that they have to have done. So that's really scared me now, because I'm way better with pain now, but still not the best. And she suggested taking 3 Panadol and 2 Nurofen an hour before the procedure. She said that after that, you know, IVF procedures and everything are just a breeze. I think it's to do with the catheter that they have to put in, because I've had an IUI done, and she said that the catheter is a little bit larger than that. So, you know, I'm kind of a bit scared about this, but I'll just read a bit about it. It says, this procedure is to assess your uterine cavity and the patency of your fallopian tubes. It uses ultrasound and sterile saline rather than ionizing radiation X-rays and X-ray dye. The procedure is usually performed between days 5 to 9 of your cycle, immediately after your period, or is by your specialist. So what does the SIS involve? Firstly, a routine ultrasound of your uterus and ovaries is performed by the sonographer. A speculum is placed by the doctor or a trained technician, kind of like having a cervical smear test, and a thin catheter tube is gently passed through the cervix into your uterus. Now, apparently that's quite sore. The speculum is removed and the vaginal ultrasound probe is reintroduced. Saline fluid is then introduced through the catheter into the uterus, where it outlines the uterine cavity and demonstrates the fallopian tubes. Once these have been demonstrated, the ultrasound probe and catheter are removed. So apparently it's kind of like period cramps when the saline is going through. This examination is often uncomfortable. You may experience a cramping sensation as the tube passes through the cervix and a feeling of distension as the fluid is introduced into the uterus. Just saying, it's essential to take some pain medication. So the possible side effects, you may have some abdominal discomfort, spotting, and it's safe to take pain meds as you need it. There's a small risk of infection, but they said they'll give a script for some antibiotics. The results will be discussed with you after the examination, so that'll be really good, and then a report will be sent to our fertility specialist. So I like that we don't have to wait. I'll just know then, because if there is a polyp, then I think my fertility specialist said we'll need to sort that out first. There's something to do about putting a camera in, and I'm not really sure about all that, but it would then obviously push IVF further back. So really hoping I don't have a polyp. I've never had one, I don't think. I have had 2 laps in the past and 2 HSGs. So I don't think they found a polyp there, but that'll be interesting. So at the moment I've been playing phone tag with Reflect Radiology and Fertility Associates, trying to sort out to book this in. Reflect Radiology said they hadn't received my referral, and then Fertility Associates said they'd sent it, so hopefully I'm going to get that sorted. Something else that happened during our fertility specialist appointment is, because my partner Henry, he has had a vasectomy reversal, they are worried that there may be no semen present, or, you know, nothing good that they can find. So he's got to do a semen analysis, because they're worried we're going to have to do a TTC, I think TESE. It's where they go in and have to surgically remove some semen from the tubes. Look, I'm terrible at this, I'm sorry, but so he's got to do that, take that in, so that'll be an experience, because he's doing it from home rather than at the clinic. And then we've got to get it is over by the airport, which is about like a 30-minute drive, I think. So we've got to keep that warm and get that there. But I'm not sure how long the results take, so we're going to have to also wait for that before we know how our IVF cycle is going to look. During our appointment, we also got this Pathways to a Child book. Hopefully that's around the right way. So this is just a really big book. I've been trying to read it slowly. I haven't really got through much of it, but there's lots of information there. So that's really cool. So I'm just glad that we got our appointment out of the way. We are really lucky. So it was a review appointment that's $190 rather than your first appointment. There is about, I think it's $300 now. I'm not quite sure. So I'm glad that we only had to pay for that, because we were actually looking at changing our clinic to, I think it's called Janaea. I'm not sure on the pronunciation, but I have heard so many good things about that clinic, that, you know, you're not just treated as a number, you're a person to them, and it's really personalized. So I have been emailing back and forth with them, and they are really, really lovely. I mean, the nurses at Fertility Associates are really lovely too, and I've had good experiences with them. But I don't know, I just wanted to see what they would offer, and especially something that's more personalized and not just feeling like, you know, in the door, out the door kind of thing. So I'm just waiting on a quote back from them. I do think that their IVF rounds are a little bit more expensive, so I'm not sure it's going to fit into our budget. But I also have Fertility Associates that are going to come back to me with a quote of what they think our cycle would look like and how much that will be, so that'll be really interesting. And I think that's about it. The appointment wasn't really that long. Sorry, that's one of my kittens going through, knocking the camera. I was just trying to think what else there was. So afterward, I'd had the scan, we'd talked about everything else. You know, she got out like this little flip book to try show, you know, during the IVF cycle, when's it's important, when you'd be coming in for scans and blood tests and all that kind of stuff. It was really hard to take in because there was just a lot. So hopefully once we know what's happening and we have, I think it's like drug orientation. Oh, I was going to show you Allie, but she's ran off again. Do you want to come say hi? She's being all shy. Oh, now she's stalking me. Come on. She's going. Come on. Oh, okay. She's ran off. Oh, there she is. That's Allie. She's our little one. Come here. Come here. What? She's so curious. She's like, why are you talking to a camera? So basically, sorry, Allie just knocked the camera off of where I have it on top of the coffee table and then also on top of an empty tissue box, so it's not really that stable. She's off in the background being crazy. So I think that's everything for the appointment. We kind of left, like, we are really, really excited, but it was also, we didn't expect to have to worry about like a polyp or, you know, there being no semen, everything like that. Like, I know things aren't straightforward, but it was still kind of a blow, if that makes sense. Still excited and looking forward to it, and just hopefully everything works out, but if not, we'll just take it one step at a time. And of course I will film once I've had that the saline infusion, hopefully with the Lipidol. I think that's how you say Lipidol. The fertility specialist did say Lipardo. Oh, that's Ellie again. So once we have those results and the semen analysis, I'll do another video and put it up. Hopefully it goes all okay, but I just want to say thank you so much for everybody's support on my last video and also through Instagram. Like, it's just so nice having people who understand. So I'll see you in the next video. Thank you. Bye.